Okay, today we're going to go over how to put in an I/O. Over here under the C's for circulation is where you're going to find everything you need to put in the I/O. And you open up the doors here. You've got your drills. Your drills will be right here. Now I got the other drill out, that's why it wasn't right there, but there's the drills. It doesn't matter which driver you get, they both work the same. Once these have reached their end of their lifespan, which would be you have no power, you have to return them to the company and get a new one. You cannot change the battery and you cannot charge them. So moving that off to the side, back in the back is the stabilizers. You'll need a stabilizer which acts as your dressing. So like when you put an IV in, you use one of those Tegaderm Opsite things. That would be the version for the I/Os. Over here you have your 3 I/O choices. The company would prefer not to use the word pediatric because they are not really pediatric. They're just 3 different sizes: 15, 25, and 45 millimeter. They're all 15 gauge. So you pick the one that you're going to need for the site you've selected. And in this case, I've got a blue one because that was the one we had left over after we had used it and it was open, so that's which one we're going to use. Now, there is a resource book available in the acute care area all about I/Os. It was put out by the company. I got access to it through the E&A, and I put this together so that anybody who wants to look it up, it's a great resource. And there is the spine of the book. Now, the basic things to remember are this. Here's your drill or your driver. And we have our bone right there. Pretend that's whatever site you chose. When you open up the kit, it's gonna look like that. That should be exactly what you see. This red thing right here is where you would put the needle when you're done, and it acts as a cap for the needle and it secures it in there. You can throw it away like that, but that makes it into a safety needle. Now, here is the actual I/O piece, and then this is going to be the tubing that connects from the I/O to whatever you're going to use, either IV tubing or flush, if you're going to make it into basically an INT type of situation. So on these, you pull out the plastic cover off your needle, you hook your drill to it, it's magnet held, and you push down. You don't engage the needle, you push straight down through the skin till you touch the bone. Then I'm going to try to do it this way. Obviously with a person you would bend over, but you should be able to see at least one of those little black lines. If you don't, it's too small. You have to get a bigger size. So one of those little black lines that are on the shaft of the needle has got to be visible. And I'll pull it out this way. Let's see if we can get that good picture of that. So yeah, you should be able to see those. So one of those lines, and you'll see the one that's closest to the hub. If you have to see that sticking above the skin level once you have this all the way down against the bone. If not, go get a bigger one. I can't say that enough. So you push this down till it hits the bone after you check, then you engage the drill and push down, and you'll feel a little poof as you go down. You pull it up, that gets your drill off, then you unscrew the needle part. That would go in the needleless, that red cap. This is your stabilizer. Stabilizer goes on top of that. So if you can see, we've got it all the way down, so it's touching the skin. It kind of keeps the hub down. Then We've hooked this up just like you would a little, whatever you're putting on an IV that you're putting in. This you would flush with normal saline. Then just put that on there. This goes on after the stabilizer goes on, and it screws in so that when it's on, it kind of helps hold the stabilizer, and the stabilizer helps hold the whole IO so it's not twerking at the bone. Then, and I didn't say twerking either. This right here is, go ahead and flush it with saline, about 10 cc's. You may not be able to draw blood back. That's not necessarily abnormal, but and you will need a little bit of a oomph to flush, but you shouldn't have the skin swelling as you're pushing, and you should be able to push through. If the patient happens to be awake and alert, you might want to be nice and use some lidocaine, because it does hurt a bit. Once it's anesthetized, you can go ahead and infuse whatever for a period of time before you may have to repeat that. We do have directions for the lidocaine both in that book and on the door of the cabinet that these are in. If you choose to put something on there like a drip that has to go in a pump, it needs to go in on a pump, because you can't do a fluid bolus with a pressure bag. You can use a pressure bag, but obviously you'd only do that for like normal saline boluses, but it's it needs a pump to get in, and then that's it. When you're done with all that, to take it out, undo the needle, or undo the connecting tubing, take off your stabilizer, and then to take out the actual IO, use a syringe, and then you just twist the syringe and pull up at the same time till you pull it out, just like that. And there you go. Now, of course, having said that, there are certain things you don't put an IO in. That would be any bone that has a fracture in it, or if there's an infectious process going on in that limb, you would avoid it. They recommend the humeral head is the ideal spot for an adult IO. It's only a few seconds till it reaches central circulation, since it is right next to the heart. It does take medication put in through the tibia plateau to get into the main circulatory system based on the laws of science and physics and whatnot. And that's pretty much it. Any other questions? I'll be happy to answer them, and or you can look at the resource book. And any medications, there also is a list in there of medications you can put through an IO. You can put almost anything through an IO, but there are certain, especially blood products, that you cannot. So check, if in doubt, check the book.